Welcome to This Explainer. Today, we're taking a really structured, evidence-based look at a major health challenge, and that's treating NASH. If you, or maybe someone you know, is navigating a fatty liver diagnosis right now, you know exactly how overwhelming it can feel. But don't worry, because today we are breaking down the exact road to recovery. We're going to focus on two main pillars. First up, the immediate, actionable lifestyle changes you can literally make in your own home today. And then we'll dive into the cutting-edge medical trials that are exploring the future of treatment. Let's get right into it.
Okay, so here's our roadmap for today. We'll start with number 1, tackling NASH. Then 2, the 1,400-calorie NASH diet. 3, dietary do's and don'ts. 4, exercise and lifestyle recommendations. 5, the gut-liver connection. And finally, number 6, exploring fecal microbiota transplantation.
Starting off with Section 1, tackling NASH, the challenge at hand. So NASH actually stands for non-alcoholic steatohepatitis. It's a liver disease characterized by fat accumulation, inflammation, and actual injury to the liver cells. Now, what's really absolutely critical to understand here is that right now, there are literally no approved drugs for treating NFLD or NASH. There's no magic pill. Because of that, lifestyle intervention, meaning exactly what you put into your body and how you move it, is your first line of defense. It is absolutely crucial. That brings us to Section 2, the 1,400-calorie NASH diet, setting the baseline. 1,400. This exact number, 1,400 kilocalories per day, is the absolute dietary baseline prescribed for a patient navigating NASH recovery. Every single meal, snack, and drink has to be calculated to fit within this strict, non-negotiable limit. It's the only way to help the liver actually begin to shed that accumulated fat. But here's the kicker. While you're restricting those overall calories, you cannot starve your body of nutrients, right? So alongside that strict 1,400-calorie limit, patients are directed to maintain a specific protein intake of exactly 65 grams per day. This makes sure your body maintains its muscle and metabolic function, all while forcing the liver to heal. To actually hit those targets, you need a highly precise 24-hour food intake plan. Notice these strict limits. You're allowed 500 milliliters of double-toned milk a day. Vegetables, they should make up a massive 400 to 500 grams of your intake. And pay close attention to that bottom row, because wow, this is the absolute clincher. Cooking oil is restricted to just 15 milliliters. That is practically a drop. We're talking roughly 3 teaspoons for the entire day. This isn't about guessing. It's about highly actionable, measured intake. Now, timing is just as important as the food itself. Small, frequent meals are definitely preferred over massive feasts. Take a look at the strategic rule for lunch here. You must eat your salad exactly 15 minutes before the rest of your meal. This is a brilliant little biological hack. It jumpstarts your digestion and ensures you fill up on fiber before you even touch your roti or dal. Moving on to Section 3, dietary do's and don'ts, making the right choices. You know, it's really easy to get tricked by foods that are generally considered healthy. I mean, sorry to the mango and cashew lovers out there, but these are strictly forbidden for NASH patients because of their high sugar and fat content. Peanuts, bananas, and grapes? Yeah, those are out too. Instead, you'll want to include digestion aids like fennel on a daily basis. And here's a super practical tip straight from the clinical dietary guidelines. When you're making roti, use a 3-to-1 combination of wheat flour to black chana or soybean flour. It's a real game changer. Let's look at Section 4. Exercise and lifestyle recommendations, the daily routine. Okay, so these are the non-negotiable lifestyle rules. Hydration is massive. You need 10 to 12 glasses of water daily. You also absolutely have to implement an early, hard stop for dinner at 8 p.m. This gives your digestive system the time it needs to rest before sleep. It probably goes without saying, but alcohol and smoking are completely out. Plus, your food prep should only involve boiling, baking, or steaming. No deep frying here. Then, of course, there's physical movement. You need to commit to a daily walk of 40 to 45 minutes. But it's not just a leisurely stroll through the park. The clinical standard of care specifically directs NASH patients to focus on stomach and abdominal exercises. Why? Because we are directly targeting the area where that dangerous visceral fat is sitting, right around the liver. Next up is Section 5, the gut-liver connection, the next frontier. So medical researchers are increasingly looking at something called the gut-liver axis. Emerging science shows that patients with NASH actually have a visibly altered gut microbiome. Basically, they have fewer beneficial bacteria and way more harmful bacteria. And since traditional approved drugs just don't exist yet, scientists are asking a pretty radical question. Can we cure the liver by rebalancing the microscopic bacteria in the gut to fight off that inflammation? And this brilliantly illustrates exactly how seriously the medical community is taking this whole concept. What you're looking at here is the official participant information sheet from a clinical trial conducted by the prestigious All India Institute of Medical Sciences, or AIMSS. They are actively inviting NASH patients to participate in some truly groundbreaking research on gut microbiome modulation. Which brings us to our final section, number 6, exploring fecal microbiota transplantation, the clinical trial. The procedure they're testing is called fecal microbiota transplantation, or FMT. Now, I know the name might sound a little intimidating or, frankly, even bizarre, but the concept is an absolute medical marvel. It involves taking beneficial, good bacteria from a healthy source and therapeutically delivering it directly into the patient's system via an upper endoscopy. The ultimate goal? To rapidly rebuild the gut microbiome and directly assist the liver in its recovery. If a patient decides to enroll in this study, the methodology is incredibly structured. It starts off with a detailed clinical assessment, which is followed by the collection of blood and stool samples to get that baseline data. Then, the patient undergoes the upper endoscopy to receive the fresh FMT. Finally, a colonic biopsy is performed. This lets doctors closely monitor exactly how the gut-liver axis is responding to the new bacteria. 8. That is the number of clinical visits a participant commits to over a 1-year follow-up period. So this definitely isn't a one-and-done treatment. During these 8 visits, patients undergo 6 distinct sessions of fecal microbiota transplantation, which ensures the beneficial bacteria truly takes hold in their system. Now, what's really interesting about this slide is the balance of risks and benefits. It's incredible. The benefits are massive. You get access to brand new treatments, incredibly close medical monitoring, and the chance to advance vital medical knowledge for everyone. On the flip side, the noted risks are remarkably mild. We're mostly just talking about the standard discomfort of an upper endoscopy and maybe the potential for a transient fever that usually resolves in just a day or two. And that brings us to a really fascinating conclusion. The fight against NASH starts right in your own kitchen, with a strict 1,400-calorie diet, precise food choices, and that daily 45-minute abdominal workout. But the future of this fight? It might just be microscopic. Could the ultimate secret to healing your liver be hiding in the good bacteria of your gut microbiome? It is a provocative question, for sure, and one that medical science is getting closer to answering every single day. Thanks so much for joining me for this explainer, and keep learning.